Welcome to the Brain Health Hookup. I'm Laurel Myers Hurst, your resident groovologist, and I believe that better mental health needs to be fun. Here we talk about mental wellness, we explore the physical, emotional, and relational needs we have as humans with the science and practices that help our mental health to flourish. Plus, we dive into my signature method, groove therapy, that engages folks in groove-based music making to lift mood and lower inflammation and pain. I'm so glad you're here. So let's hit it. Well. That's a deep subject. If you haven't heard of a groovologist before, that's because it's a term I started to use for myself last year. You probably don't know me, but I am trained and working as a psychiatric nurse practitioner in adolescent through adult care. And my life before becoming a nurse practitioner, I was a music professor and an ethnomusicological researcher. Ethnomusicology became very famous lately because of the movie Inside Out 2. All of a sudden, people are saying, what is an ethnomusicologist? Which was a question that came up a couple times in the movie Inside Out 2. An ethnomusicologist is a person who learns about other people using music as a tool, kind of like how archaeologists use artifacts as tools to learn about people. Ethnomusicologists use music to learn about people. So those two veins of my life have joined now in the introduction and integration of groove-based music making and mental health. I'm an expert in delivering groove-based music making in shared medical appointments. So in the context of psychiatric care, substance use recovery, and general wellness, we're using drumming to teach, to inspire, to lift mood, to reduce inflammation, so many benefits of drumming together. I just want to tell you about a story about one particular participant, somebody in a substance use detox situation. Those are hard days. Weaning yourself from a substance that you have been using regularly, that you have a strong desire to remove yourself from its influence. Those are hard days. And I remember specifically sitting in a group with 12 individuals who were all in this process of detox. We did a little exercise called Say Your Name, and the drum speaks your name. I say my name on the drum like this, Laurel, and everyone repeats my name back to me. We go around the circle. Everyone says their name on the drum, and the group repeats it back. It's amazing to hear everyone as a chorus of drums repeating your drum name back to you. Well, my name again, Laurel, went over fine. Several people went in the group. We all understood the assignment. Then we got to one young lady, we'll call her Stephanie, but as soon as it came close to her time, I saw her get more and more tense as we got closer to her in the circle. When it was her actual turn, she's totally slumped inward. And she kind of peered at me through her bangs and said, I just don't even know where to start. And I didn't say anything. I just looked at her with my softest eyes possible. I literally put my hands on the surface of my drum with my hands up and just paused. And she lifted her hand as if she might do something and lowered it. And lifted her hand again as if she might do something and lowered it. And lifted it a third time and said, Stephanie. And she just hit the drum one time with a loud exclamation of her name. And the whole group immediately chimed back, Stephanie, on their drums. And she looked like the 4th of July fireworks went off in her heart. You can see how emotional I'm getting already talking about this story, because that is the power of the drum together in a group. It's not, the drum is nothing magical. The exercises we do are nothing magical. What is, I think, magical is the ability to put something out into the world and to receive something back from our peers. The benefits of that are amazing. I've heard statistics similar about even marriages or long-term relationships, that when one partner appeals to the other partner for some type of response, if they receive a response, that predicts wildly more opportunity for success in their relationship long term than if the other partner turns them down, turns them off, ignores, or just doesn't respond. So we have this group process going on in drumming. Then the activity does engage both sides of the body. So you're getting a bilateral type of stimulation that we know throws miracle grow on the brain. Many people in the context of healthcare have had the opportunity to join a drumming circle if they are healthcare employees. Most of them look back at it as one of the highlights of their experiences, like one of the greatest things that HR ever did for them. So some people in healthcare are already familiar with drumming. But other people, when I say I use drumming in mental health, they say, drumming what? Or what do you mean drumming? I mean, like drumming, like on a drum. And they'll look at me, and about 12 seconds later, they'll say, oh, you mean like drumming? It's so common for these ideas of healthcare and drumming to be so separate in people's minds that they can't imagine it. The job of a groovologist is to both study and implement and refine the process of integrating groove-based music making in healthcare, especially mental health care. So the benefits are great. I already mentioned healthcare workers experience. Daisy Fancourt, who works for the government in the United Kingdom, has done a lot of research, as well as Barry Bittman in the Highmark insurance system, about how much benefit there is to healthcare workers in terms of reducing burnout and improving mood. So I think there's something special happening when care providers and care receivers drum together. In most cases, the people that are delivering the healthcare are like the experts, and the people who are the patients are sort of receiving everything, and they have to digest it, and they have to make use of it, and they have to trust greatly the people who are providing care for them. But when they drum together, they're kind of on equal footing, right? It's not an expert receiver kind of situation. It's more like we are none of us experts on this. There are definitely some culture bearers who are very adept at drumming and creating groove-based music. But most of us, we are receivers and consumers of groove, not producers of it. But the benefits from producing groove together are phenomenal and evidence-based. And that's my passion, to bring something that so easily lifts mood, reduces inflammation, and we can show that through blood tests, and reduces pain, not just over time, but very quickly. If you want to experience this type of really novel thing, I do drop new grooves on occasion on Thursdays into my Facebook group. If you check the show notes, you can connect with me there, see what we've done in the past, and experience groove yourself. I am the least likely drummer, okay? I am from Northwest Pennsylvania, born of Appalachian parents. I came into groove in my career as an ethnomusicologist, but I'm not a culture bearer. I even have nerves messed up in my left arm. I'm a singer. I'm not even an instrumentalist in my music career. So I'm the most unlikely person to promote and to practice drumming. So if I can do it, you can do it. And I invite you to check it out in our Facebook group. I'd love to hear your questions about groove-based music making and what I call the groove therapy model. We will be releasing our book this fall that talks about many of the benefits that I see the parallels to good communication and good relationships that we find from syncing into a groove together? Let me know about your questions about groove therapy. Our book is coming out this fall that goes chapter by chapter through the things I have learned about communication and relationships by drumming with other people, by leading other people in drumming. Like going back to Stephanie, this was a person who was in dire straits, felt physically terrible, was shut down in communication with other people, and really lost touch of her own ability to generate influence and generate novelty, new things in her life, right? But through that one exercise of just exclaiming her name and hearing the group respond in chorus back to her through their drums, the connection that she felt, the sense of achievement, the sense of will and drive to go on to fight another day. Sometimes that is what people with mental health problems need. That's what I need. And I hope you benefit from all the goodness that Groove has to offer. Thank you for tuning into this episode of the Brain Health Hookup. I hope this episode radiates with the conviction that generating mental wellness needs to be fun and safe. We want you to find your power and understand your innate design to flourish in everything you do. And we hope that inspires you to come back and listen for more. I'd love for you to leave a review of this podcast, as it helps the show grow to reach more people who need to make mental wellness fun. You can find the leave a review button, as well as all the YouTube visuals, bonuses, and ways we can help to support you on our website, podcast.grooveforhealth.com. I appreciate you more than words can say. See you next time, and remember, together we have everything we need.